Hi everyone, welcome back to your channel I Love Pharmacology, and in this session let us see the high yield nodes from the muscarinic receptor agonist, antagonist as well as anticholinesterase agents. So basically we're going to concentrate on the important uses of these agents which were asked in your previous competitive exams. So coming to the muscarinic receptor agonist, we have these are the drugs which will going to activate the muscarinic receptors. We have examples like methacholine, which was used for diagnosis of bronchial airway hyperactivity. So this is the question which was asked. So which among the muscarinic receptor agonist can be used for bronchial airway hyperactivity testing? So it is methacholine. The next we have a carbachol. Carbachol is used topically in the treatment of glaucoma, and bethanachol is used in the treatment of the ileus, that is post-operative ileus as well as neurogenic ileus as well as urinary retention, as these methanocol will going to contract the muscarinic, contract the muscles through the M3 receptor present in the intestinal smooth muscles, the urinary bladder. So methanocol can be remembered as, so all the uses will start with bowel and the bladder. So bethanocol is used in bowel like postoperative ileus and the neurogenic ileus, as well as in the bladder condition where the urinary retention, to relieve the urinary retention problems or symptoms, we can use bethanocol. So next, coming to the very important drug, that is pilocarpine. So it is used topically in the treatment of glaucoma, as it reduces the secretion of the aqueous humor, and also the pilocarpine acts on the M3 receptor which is present in the eye. It will going to cause pupillary constriction, widen, widens the pupillary angle. That is, the iridocorneal angle will be widened so that aqueous humor drainage will be easier. It can be used for xerostomia condition where there is a dry eye association in clinical conditions like Sjogren syndrome. And in case of head and neck irradiation, pilocarpine is used to prevent the dryness of the secretions due to the irradiations. So next we have a cevimeline, which is a container of the pilocarpine, which has been used successfully in the treatment of xerostomia, that is the dry eye condition due to Sjogren syndrome. So this was about the muscarinic receptor agonist. Then we'll move on to the muscarinic receptor antagonist. Under this very important drug is atropine. Atropine is used for AV blocks for treating the acute symptomatic bradycardia. Whenever there is a heart rate is less, you can go with the atropine. The next, it can be used in the treatment of the organophosphorus poisoning, that is cholinesterase inhibitor intoxication, that is OP compound poisoning. You can use atropine. So atropine is a drug of choice in case of OP compound poisoning. You can not use the uh, enzyme reactivators if the poison is carbamate type. Only in case of OP compound organophosphorus poisoning, you can go with the atropine as a drug of choice, and you can go for oxime for enzyme reactivation. Then atropine can be used for in case of aspiration prophylaxis, as it reduces the secretions. So what do you mean by the muscarinic receptor antagonist? The atropine will going to block the activity of M3 mediated uh, actions. The next very important drug is scopolamine, which is also called as hyoscine, which is used in the treatment of motion sickness. So it is applied in the form of patches, pinna, that is on the mastide process. The next very important drug, homatropine and the cyclopentolate and tropicamide, they are used for producing mydriasis, means dilatation of the eye. Please remember, pilocarpine will produce meiosis, that is a constriction, whereas the atropine related drug, receptor antagonist, will mydriasis, and also since it blocks the M3 receptor, on the ciliary muscles, it produces cycloplegia and there will be loss of dilation. So this can be utilized for the dilatation of the eye, can be utilized for ophthalmological examination. And next we have a ipratropium, iotropium, which are mainly used as an inhalational agent in treatment of the COPD and bronchial asthma. So ipratropium bromide, iotropium bromide, or the M3 receptor antagonist, which are useful in the treatment of asthma, COPD, as these drugs will going to decrease the secretions which are mediated by receptors in the smooth muscle. Next we have a pyrenzapine and talent. These drugs will going to block the M3 receptor in the stomach, decreases the secretion acid. So thereby it can be used in case of peptic ulcer disease. Next we have a very important group of drugs, that is oxybutynin, trospium, derifenacin, solifenacin, tolterodine, and fesoterodine. That is the soft bladder. You can remember it as soft bladder. S stands for solifenacin, O stands for oxybutynin, F stands for fesoterodine, and T stands for trospium, and soft bladder, der, that is derifenacin. So they are useful in the case of overactive bladder. So whenever there is an increased contraction of the M3 receptors which are present in the bladder smooth, so to control the overactivity of the use muscarinic receptor antagonists. So they are useful in overactive bladder and uremic bladder. So glycopyrrolate, which is very important drug, which is used in the treatment of duodenal ulcer to decrease the secretion as well as to decrease the gastric acid secretion. Thereby, it prevents the aspiration during any surgical procedure. So it is used as a pre-anesthetic medication as well. So glycopyrrolate can be used in treatment of sialorrhea to decrease the secretion. So it can be used in the treatment of primary axillary hyperhidrosis and dicyclomine and iosamine. So very important drug to reduce the symptom related to abdominal pain which are associated with diarrhea and irritable bowel syndrome. The next we have trihexyphenidyl and benzotropine. These are the central anticholinergic agent which are useful in the treatment of drug-induced agonism. The next, coming to the anticholinergic agents, these are the agents which block the activity of the acetylcholine. Anticholinesterase agents will act similar to that of the muscarinic agonist, as these drugs will increase the acetylcholine level. So we have a non-covalent reversible inhibitors, carbamate inhibitors, and the organophosphates. Under the non-covalent reversible inhibitor, very important, the hydrophonium, which is short-acting agent used in the for the diagnosis of TBs. Then we have atacrine, donepezil, galantamine, etc., which are used Alzheimer's disease. Hydrophonium is used for diagnosis of myasthenia gravis, which can differentiate between the myasthenic crisis and the cholinergic crisis as well. So tacrine, donepezil, galantamine is Alzheimer's disease. Next, the carbamate inhibitors. We have a reversible carbamate inhibitors like physostigmine, neostigmine, pyridostigmine, abinonium, rivastigmine. So whereas pyridostigmine, neostigmine, and abinonium are used in the treatment of myasthenia gravis. So they do not cross the brain barrier. These drugs are the periphery. So neostigmine can also be used in case of paralysis as well. Atony of the urinary bladder, as these conditions will be improved on M3 receptors, the smooth muscles of the intestine as well as the smooth the urinary bladder. So rivastigmine, very important drug, which can also be used in Alzheimer's disease along with the donepezil, etc. Then we have a pyridostigmine as a prophylactic use for preventing or protection against the nerve gas agent attack. Apart from that, we have a carbamate insecticides, that is carbaryl, oxor, aldicarb, etc., which can cause carbon poisoning, where again the drug of choice will be atropine, but oximes will not be effective poisoning. So organophosphates, we have a ecothiopate, which has been used in the treatment of glaucoma, which is we have a nerve agents like DFP, tabun, sarin, soman and cycloserine, etc. So please remember, these are the alkyl phosphorates that are the most potent synthetic toxins, and typically they are methanes. So they react covalently and with the active site serine, and they are potent irreversible activators of the cholinesterase. That's why in organophosphate poisoning, you give atropine as a drug of choice, and to reactivate the cholinesterase activity, you need to give oximes as early as possible. So this in nerve agents are documented as agents for bioterrorism. And pesticides, we have a parathion, parathion, diazino, and chlorpyrifos, etc. All these are the insecticides which are largely used in agricultural sector, and malathion can be used topically treatment of pediculosis whenever there is a resistance for permethrin. And also lethal dose of malathion in mammals is 1 gram per kg, and use of these agents, that is pesticides, chlorpyrifos, are widely used in agriculture, and indoor use of these drugs discouraged in agricultural practices as well as for the indoor uses. And also one should remember the uses of the muscarinic agonist and antagonist, and uses of anticholinergic agents for your examinations. So if you find this video useful, please do subscribe to our channel